Now there's these little areas here called ferrum chromatose. It looks like someone's taken orange powder, orange brown powder, and blown it on there with a straw. It's also called tiger striping, which is, I think, a cuter name. This means that the liver needs to be cleared, possible issue with iron stores, and a possible issue with any kind of blood deficiencies, anemias, and this person does have a lot of problems with anemia very easily. Okay, over to this side here, your left side, you can see there's a dark opening. This is the throat area. It's called a rarefication. It means that the fibers have split here, and because of the color being a bit gray, dark gray, it means it's been an old chronic issue. And this person had tons of strep throat and laryngitis in the late teens and 20s, and has a lot of talking for her career, and so has some issues in the throat. So you want to make sure that she lets her doctor know that, get that checked out, and she has in her past. She's seen an ENT and everything is good there, but there is a lot of strain on the throat, the ENT said. So now we know that this patient needs just to watch the way she speaks, maybe take singing lessons to learn how to speak properly, or just be careful when the throat is tired to really rest it. Okay, also on the left here you see an arrow going called yellow catarrh kidneys, going down to a bunch of yellow. If you really sit back, you can see a bunch of yellow coming out of that orange starburst in the eye. The yellow color means the kidneys need to be cleaned. It's called kidney catarrh or kidney congestion. So this patient may have possible UTIs, bladder infections, but because I don't see a lot in bladder, down here, I'd say more mucus issues with the kidneys, dampness we call it in Chinese medicine. So possible cloudy urine, leukorrhea, which is vaginal discharge, possibility to candida or vaginal discharge from candida, bloating in the lower area, feeling of fullness in the bladder, and she does tend to go towards a lot of those things. So this yellow catarrh tells me the kidneys are going to need some cleaning herbs, or with acupuncture I may choose points to move and clean the kidneys. Okay, now go down to the bottom of the eye. If you look at the eye like a clock, it's around 6 o'clock. There's a gray area there and rarefications, meaning the fibers have split apart. Now these rarefications here are in the kidney adrenal area, which means that most likely she has burnt herself out, and I'm going to talk about most likely why she did that soon. And so this probably would indicate a little bit of exhaustion or easy towards exhaustion. You may want to ask in the late afternoon if she has a lot of trouble staying up and needs to nap, or feels exhausted, or has really burnt herself out in the past. So this is showing that we need to really nurture that area back up. And this is true. She tends to burn herself out a lot and gets very tired in the afternoon, so this really matches for her. So let's talk about maybe why this patient has that. First of all, she's neurogenic. Remember, her constitution, all the fibers are very tight together, so she's going to have a tendency towards high energy, but high energy to overly burn out, not getting adequate rest. So that's one of the reasons for it for this patient. Also, if you go to the right side, you'll see it says sectoral contraction furrows, muscle tension and spasms. You know, you see how these white lines going around like the rings of a tree. There's 1, 2, 3, 4, 5. I think there's 4 or 5 layers throughout the eye, and they're all segmented. Now, contraction furrows mean that the pupil has dilated and constricted quite a few times, which you see a lot with stress because it represents the central nervous system. It's someone running on empty, really running on their adrenal energy. And so people can be born with these, or they can create these. These do not go away in the eye. And so so this is probably why she's burnt herself out, is she has a very hyper energy that pushes itself into the world too easily and has a difficulty resting and finding adequate time for breaks. So when you see this too, you tend to see a lot of muscle pain from tension. So probably when this person is completely relaxed, you may have no muscle pain. And when I ask the patient that, it's absolutely true. Lots of tension in the body and lots of burnout. And we can see why her tendency is to really push herself. So she has to be careful to really calm herself down. That will help prevent a lot of issues in the future. Okay, on the right side here you see cholesterol ring. This is the very beginning of possible cholesterol for the patient, but remember this genetic disposition too. You want to ask about the family because there's a lot of liver toxicity. We really want to make sure it's clean also to help with cholesterol. Her her father's side has cholesterol, so she's 37. It may be starting to creep towards her, or the tendency's showing up now. So she may want to see her doctor and just get her cholesterol checked soon. And if that's the case, we'll do a lot of liver cleansing and diet changes. Now, what this looks like is, looks like the sclera is kind of moving into the iris. It's moving over the iris. It's very early, so it may be difficult to see, but there's a slight clouding on both sides here. Okay. The next part we're going to go to is the bottom here. If we're looking at it like a clock, it's around 5 o'clock, 4:35. Now here we have a lymphatic rosary called tophi or flocculations. I love that word. So it's little cotton puffs. See around the eye here, puff, puff, puff. Puff, puff, puff. Have a sit back if you can't quite see it. We've got orangey kind of brown puffs going all around. Now this is the circulatory lymphatic, pardon me, this is the lymphatic area of the eye, the outer lymphatics where it's sitting. And so this is showing that looks like pancreatic and a little bit of liver problems causing congestion in the lymph. And now the lymphatic rosary will not go away with cleansing, so this is a tendency. So this patient needs to be very careful about mucus-forming foods like cow dairy, sugar, greasy foods, deep-fried foods, wheat, poor quality wheat, I should say, any kind of food allergies, because that could cause congestion in the lymph. We might even put her on Mullein or Cleaver's tea to really clean the lymph. A lot of high sodium foods, no, not salt, but high sodium like celery, beets, to really clean out the lymph. Okay, next here, let's see, I don't want to miss anything. Left here, on the left, there's around 8 o'clock, you see this thing called a scurf rim. You see that the whole outside of the eye has a darker color to it. That whole outside area represents the skin or the circulatory system. Because it's darker, that means that it is a tendency to have issues in one or both of those areas. And lo and behold, she came in for eczema issues also. And so I can see that her skin has trouble detoxing. Okay, I think that's everything I can see from this patient. Now, when I finish this reading, it sounds scary. It sounds like, oh my goodness, I'm going to pass out or die at any time here, but don't take it that way. These are tendencies. These are very early prevention methods to use. So this patient, we're going to make sure she's off of cow dairy. There's a lot of catarrh, congestion here. There's the lymphatic rosary. Off of wheat, a lot of digestive sensitivities, too difficult to digest, anything hard to digest. So any food allergens we're going to look for. We may have to send her away to a naturopath or doctor to find food allergens if we can't find them. And make sure she's cleaning the liver once to twice a year, or if she's in an acute phase of something, maybe to get onto a liver cleanse. We have to make sure that this patient knows to rest, not push herself too hard. If she gets sick, she may get sick quickly and bounce right back. That's very neurogenic with the eye. But if she is getting burnt out, rest, go on a vacation, and really, really relax. If she cannot do that, which is how it goes these days, then about 4 times a day to take a moment, close the door, put a candle on, whatever, turn the phone off and just rest for 5 minutes and reset that nervous system and calm it down. If there's possibility for an afternoon nap, that's perfect for this patient, probably for her whole life to do that to really prevent any issues. Watch her throat. We'll clean the kidneys out. Maybe some parsley tea would be a great idea. Very easy one to do, and with taking those other foods out. Scurf rim is happening, so maybe some hydrotherapy, hot, cold in the shower to really help circulate the lymph and also circulate through the skin. Maybe some skin brushing or some great herbs and foods to help open the skin up. Some sweating, like saunas and stuff would be great for this patient because she's quite strong. She can sweat to really cleanse the skin and help clear out that eczema. So really, the short and skinny of it, this patient is cleanse that liver, tonify the digestive system with herbs, acupuncture, whatever you use. Ask her to try and keep calm as much as she can, or work on yoga or calming lifestyle activities, and clean out the liver for the most part, maybe digestive enzymes for the digestive system. So that's where we will start with it. One thing I forgot, I just noticed, the very top here, it's hard to see. You can see it's a bit of a clouding there too. This is called brain anemia. It's a horrible term, I think, but it means that there's a little bit of low circulation getting to the brain. So with this cholesterol ring starting here, or with all this tension in the bodies and in the muscles here, we might want to consider that we need to work on those to see if we can get higher circulation to the brain. Okay, I think that's all I see for that patient there. It's a very healthy, active 37-year-old, and cleaning her out works very, very well. It's very easy to treat her, and that is how iridology works. So you can see I'm not diagnosing Western-wise. I'm just looking at the tissues, seeing her tendencies, and preventing a lot in the future. Okay, thanks for listening.